Welcome to this explainer. Okay, picture this. Your entire society just collapsed. Everything you thought was totally stable is just gone. A massive wave of anxiety and helplessness is washing over your community. Now, I know what you're thinking. That sounds a lot like the modern mental health crisis we hear about literally every day in the news, right? But actually, scratch that. We're talking about ancient Greece. Today, we're diving into a really fascinating time travel connection. We're going to explore how the intense post-war anxiety of the ancient world birthed a philosophy that serves as the exact foundation for how we treat mental health today. We're breaking down how the historical origins of Stoicism directly influence cognitive behavioral therapy through three core pillars, and we'll also take a hard look at its practical utility in our messy, complex modern world.
So the huge question we've got to ask right out of the gate is this: can ancient philosophy actually cure us? It's a pretty wild premise, right? I mean, we usually think of modern clinical psychology as this purely 20th century scientific invention, built in these pristine labs and clinical offices. But what the research actually reveals is kind of mind-blowing. A 2,000-year-old philosophy from ancient Greece and Rome, that is the actual literal blueprint for modern cognitive behavioral therapy, or CBT.
Section 1, Philosophy for Suffering. Following the devastating Peloponnesian War, the great city of Athens fell. Life became profoundly miserable, the social order was completely destabilized, and people really lost their sense of control over their own lives and communities. It was a total societal crisis of misery.
A practical philosophy for a world out of control. So, in response to all this historical chaos, the thinkers of the time had a realization. They realized that, hey, high-minded abstract metaphysics, that's not going to help a starving, anxious population. Thinkers like Zeno of Citium completely shifted the entire direction of philosophy. They basically transformed it into a practical medicine of the soul. It was designed as a highly practical toolset for a world that felt completely out of control. Philosophy wasn't just about understanding the universe anymore, it was about actually surviving it.
Section 2, The Bridge to CBT. How exactly did this ancient, practical medicine survive the collapse of empires and bridge the gap into the offices of modern clinical psychologists? Well, it wasn't an accident. It was a very deliberate historical journey.
Let's trace how this lineage actually builds. In 334 BCE, Zeno found Stoicism on a painted porch in Athens. Fast forward a bit to the 1st century CE, and Epictetus is formalizing these teachings. But then, and this is where it gets really interesting, look at the jump to 1904. A Swiss psychiatrist named Paul Dubois starts using Stoic principles in his clinic. He was literally giving his patients passages from Seneca as homework. No joke. This directly inspires Albert Ellis in 1955 to create rational emotive behavior therapy, and shortly after that, in the 1970s, Aaron Beck formulates CBT. Both Ellis and Gauck explicitly credited the Stoics as the philosophical founders of their highly effective modern therapies. Okay, let's dive into this. Men are disturbed not by things, but by the views which they take of them. This quote from the 1st century Stoic philosopher Epictetus, it is the absolute linchpin of CBT. It's the foundational premise that psychological suffering doesn't come directly from external events, like say losing a job or a global pandemic, but from the judgments, the interpretations, and the cognitive views we attach to those events. It's like a giant puzzle, and this is the exact mechanism behind what therapists today call cognitive restructuring.
Section 3, The Three Fundamental Pillars. So how does this actually work in practice? Stoicism operates on a very specific framework, a rule of three that forms the core mechanics of how this ancient philosophy was translated into modern therapy. Logic, acceptance, and control. These three pillars aren't just isolated ideas floating around. They work sequentially to completely restructure our cognitive approach to emotional distress. By applying these three pillars together, an individual can, theoretically, dismantle any catastrophic thought pattern. Let's break them down one by one to really grasp how they function.
First up is logic, differentiating accurate impressions from faulty ones to align expectations with reality. So the crucial point here is that for the Stoics and for modern CBT practitioners, emotional suffering hits us when our expectations just do not align with reality. Logic is the tool we use to separate accurate impressions of the world from faulty ones. In CBT, this means identifying cognitive distortions, things like catastrophizing or that classic all or nothing thinking. By replacing rigid, hard demands with flexible preferences, basically saying, hey, I prefer this doesn't happen, but I can totally handle it if it does, you stop that faulty logic right in its tracks before it creates anxiety.
The second pillar is acceptance, embracing all of nature, including tragic elements, without overly optimistic or pessimistic judgments. This means embracing everything, even the tragic stuff like pain, loss, and misfortune, because, well, they're just natural laws of life. The Stoics really warned against making overly optimistic or overly pessimistic judgments. You just accept the facts exactly as they are. And this ancient concept maps perfectly onto modern treatments like dialectical behavior therapy, or DBT, which teaches radical acceptance. It's the idea of accepting difficult situations completely, without letting them dictate your actions or spiral into unnecessary suffering.
And the third pillar is control. The Stoic dichotomy separating external events we cannot change from internal thoughts we can. This is all about drawing a hard, strict line between external events we simply can't change and the internal thoughts and attitudes that we absolutely can. Clinical research shows that violating this dichotomy leads to what's called wasteful cognition. That's when you invest massive mental energy and actually cause metabolic atrophy in the brain by worrying about things completely outside your control. By focusing strictly on our own internal responses, we massively reduce our psychological wear and tear.
And this brilliantly illustrates the real-world power of these ideas. This isn't just nice philosophical theory, this is backed by hard empirical data. When patients apply these Stoic-inspired CBT techniques, the clinical metrics show some truly astonishing impacts. To put that into perspective, we're talking about up to a 51% drop in salivary cortisol, which is your body's primary stress hormone. We also see a 38% clinical improvement in depressive symptoms and a 32% reduction in anxiety sustained at the 1-month mark. Applying this ancient framework has profound, highly measurable neurobiological and psychological benefits.
Section 4. Blaming the individual. Now, this brings us to a critical dialectical twist in our analysis. If our distress is entirely rooted in our perception and our cognitive judgments, does this philosophy carry a fatal modern flaw? Does the very tool designed to free us actually trap us in a different way?
We face a pretty stark contrast here as analysts. On one hand, we have the therapeutic focus on internal cognitive restructuring, fixing your own thoughts, right? But on the exact opposite side, we have the glaring reality of external systemic issues. We're talking about objective things like poverty, severe workplace burnout, and institutional violence. Critics of CBT and simplified Stoicism point out that by hyper-focusing on our internal perception, we might accidentally be ignoring the very real, material causes of human suffering.
This leads to a very serious question. Does focusing purely on perception risk dismissing legitimate reactions to injustice? If a worker is facing extreme burnout because of a toxic, exploitative system, telling them to simply reframe their reality or accept what they cannot control could be, frankly, highly problematic. There is an ongoing, lively debate in the psychological community about whether Stoicism and CBT might accidentally serve as tools for societal domestication. Essentially, are we blaming the individual for suffering that's actually caused by broken systems? And does that ultimately discourage collective action to fix those systems? Section 5. Therapy versus philosophy of life. While CBT borrowed heavily from the Stoics, they are not exactly the same thing. To truly understand this topic, we need to address the major difference in scope between modern psychiatric therapy and an ancient way of life. The distinction here is actually super clear. On one side, you have CBT, which is a targeted short-term therapy for specific disorders. You go to a practitioner because you have a specific treatable problem, like a phobia or panic disorder, and you want to fix it quickly. Stoicism, conversely, is a lifelong philosophy for virtuous living. It's not just something you do for 12 weeks to feel a bit less anxious. It is a whole, all-encompassing framework for existing in the world and achieving moral virtue over the span of your entire life.
So, the ultimate goals are completely different. Therapy aims for symptom relief. It's a phenomenal, pragmatic tool to get you back to a baseline of psychological comfort. But those ancient philosophers, they believed true healing required way more than just feeling okay. They aim for Eudaimonia, which basically translates to profound human flourishing, virtue, and total fulfillment. They believed that you literally had to transform your entire character, acting with deep moral courage even when facing intense adversity.
How do we balance accepting the unalterable with fighting to change injustices? That is the final, provocative thought I want to leave you with today. We know for sure that mastering our internal thoughts using these ancient pillars can cure our anxiety and drastically reduce our stress. But as we navigate this crazy modern world, we've got to constantly ask ourselves, when is it time to accept our internal reality, and when is it time to step up and actually change the external world around us? It's a tricky balance we're all still striving to find. Thank you so much for joining me for this explainer, and keep questioning.